Earlier, I spoke to Dr. Peter Chin Hong. He specializes in infectious diseases at the University of California, San Francisco, and I asked him what the U.S. can learn from Israel's vaccine distribution plan.
Simplicity is the issue here. I think in the U.S., even though conceptually having a tiered system makes sense with, essential workers, etc., I think on the ground level, it's way too complicated. And I think something as easy as an age cutoff and large distribution sites are really the order of the game here. But more importantly, I think Israel has things that we don't have, which is a national information system around health and a national health system, which again makes it much easier than when you have multiple currents moving together.
So here in the U.S., Dr. Deborah Birx, the former coordinator of Donald Trump's coronavirus task force, she gave a rather damning interview to CBS. She revealed that there was no White House team working full-time on COVID-19, and she said that someone on the inside was offering the president parallel data that was inconsistent with what she was providing him. Are you surprised by some of the things she's saying?
No, and I suspect that even more information will come out later on. It's not surprising. Again, Deborah Birx was one of our own scientific community, and I think many of us were mystified when certain pronouncements were coming out from the White House, which seemed diametrically opposite to what we were wanting to say in the field.
She warned of the risk of politicizing technocrats and doctors, specifically during this time of the pandemic. I want to ask you, a year ago, it took 100 days for the U.S. to reach 1 million confirmed infections. It's now taken less than a month to jump 5 million cases. This isn't just increased testing, is it?
Definitely not. When you look at the test positivity rate, that is a better indication of, whether or not increased testing as a result of this. And certainly no one can dispute increased deaths due to COVID and increased hospitalizations due to COVID. That's kind of more black and white.
Is the main problem in the U.S. supply or distribution?
It's a little bit of both when you think about the vaccine, but mainly distribution. When you look at the percentage of doses that have actually gone into the arms of people, there's a lot of variation around the country. Again, coming back to Israel, you have a North Dakota or West Virginia where they decided to take things into their own hands and be more unified rather than have a federal stream, a state stream. It makes things much more complicated.
Dr. Peter Chin Hong from UCSF, thank you for your insight.
Thank you, Roee.